Hello, today we're going over Chapter 19 in the MDA book. We're starting with the chain of infection. So with the chain of infection, you have an infectious agent, a reservoir, a portal of entry, a portal of exit, a susceptible host, and a mode of transmission. So what are those things? Those are the 6 things. Think of them as like a fence, and they're linked together. Just like a fence, if they're not linked together, they really don't mean anything. If you have 6 fence links and they're all broken, they're not going to keep anything out or in anywhere. If the chain of infection is broken, it's no longer a chain, and you cannot have infection with anyone. So you can't infect anyone if you're missing any one of these links. So we need to make sure that we're breaking that chain of infection so that we aren't infecting anyone else or ourselves. So with the infectious agent is the pathogen. So it can be bacteria, it can be a virus, it can be fungus, a parasite, a prion. It can be any of those things, but the organism has to be virulent. So virulence is meaning that it has to be enough of the pathogen or a strong enough pathogen to make us sick. So that's our number 1 link. Our number 2 link is the reservoir. That's where the microorganisms live and reproduce. It has to have somewhere like the mouth, the body, in our hair, somewhere for the reservoir to live. The portal of entry is where it enters our body. So like when we're coughing and spewing out all of that sputum and bacteria, other people are inhaling it. When they're inhaling it through their mouth, through their nose, that's their portal of entry. So portal of entry isn't always the mouth and nose, but those are some very good examples. And in dentistry, that is the best example, is their mouth, nose, or eyes. So then we have a portal of exit. So that's when the pathogen exits the reservoir. So again, when we're coughing and we're spitting out all of that stuff, our mouth and nose is the portal of exit in that case. So even though it was the portal of entry for the person next to us, it's the portal of exit for us when we're spitting it out. If they're inhaling it, it's the portal of entry. If you're exhaling it, it's the portal of exit. So if an organism is not very virulent or strong, it might be incapable of causing disease. On the other hand, if it is very virulent or very strong, like COVID, it can cause a very serious disease. So if you're next to someone who's very ill and they're coughing and you breathe that in, the chances of you becoming ill as well are higher. If you're next to someone that has a very minor cold and is on the tail end of that cold and they're coughing, you may not catch that cold, and the chances are lower that you'll catch that cold. So always follow the infection control techniques that you're going to learn so that you can reduce the chances of you becoming infected. So the next thing is the susceptible host. That's someone who's unable to resist infection by a particular pathogen. So whether it is something that is very virulent, that's very strong, and that can get you sick easily, or something that is not virulent. If you're a susceptible host, that's someone in particular who may have a lower immune system, who's already sick, or maybe someone that gets sick very easily. So that could be a young person, an older person, someone that has a weakened immune system for whatever reason. They may have another illness that causes them to get sick easily. So the susceptible host is someone that can't resist that infection. Sometimes the susceptible host is also someone who is healthy, but they still can't resist the infection. So think about that when you are out there and you need to wash your hands. You need to keep that hand hygiene good. When you're out working in the field, it's important to wear that PPE all the time, every time. Your gloves, your mask, your eyewear, your lab jacket over top of your scrubs, your face shield. You're always going to be wearing your PPE in every situation, not just in situations that you think that you're going to have, you know, spatter or spray. You're going to wear them all the time, even when you're taking x-rays, because the patients are breathing. They may be coughing, things like that. So you're always going to be protecting yourself in every situation because it could be a very virulent pathogen that you're exposed to. So with the mode of transmission, there are several modes of transmission or ways that these pathogens can be transmitted to you or your family members. We're going to go over this list of modes of transmission that we have listed in front of you here. So with our modes of transmission, we have direct transmission. Let's go down a few slides. Here we have them listed in disease transmission in the dental office. Let's start here instead. So every dental office should have an infection control program designed to prevent the transmission of disease from patient to patient, patient to dental team to patient, dental office to community, community to dental office to patient. So with the patient to the dental team, it's the most common route. It's when you have direct contact with the patient's blood or saliva, which you're gonna have. I mean, the patient's gonna have saliva coming out of their mouth. They're gonna be bleeding, whether they're a healthy patient or not. You're gonna have blood contamination on your instruments, on the accessory products, on your gloves. You're going to have droplet infection. That droplet infection is going to be in the spray and spatter that come out of the handpiece, that are in the air water that come out of the patient's mouth, that are being suctioned through the HVE and the saliva ejector. You're going to get it through indirect contact through these items. When you are touching these items after you're cleaning up, during the procedure. So indirect contact means that this blood or saliva has touched something, it could be the counter, could be the handpiece, whatever, and then you touched it. So it didn't directly touch you, didn't come flying out of the mouth and touch you, but it did touch something else that's in the treatment operatory, and then you touched it. So it still has that live pathogen in it. It just didn't, it touched something else before you touched it. Then you have infection control measures that you need to follow and you need to think about. Those gloves are so important, and make sure that they are intact. They don't have rips, tears in them. Hand washing is your number one go-to. You're going to wash your hands before gloving. You're going to wash your hands after gloving. You're going to wash your hands in between every patient. You're going to wash your hands all the time. Hand washing is your number one to reduce that bacteria. Your masks, you're going to wear different level masks. You may wear a level 1 mask when you're seeing patients taking x-rays, but when you're doing something that has a lot of spray and spatter, you may wear a higher level mask, like a level 3 mask for protection. Face shields and goggles. Now, remember, goggles and face shields are for your eyes. Now, if you're wearing a face shield, you still have to wear a mask. Just because it goes down, hangs down past your mouth, that is not enough coverage for your mouth. You need to have a mask on and cover up the oral cavity so that you're not breathing in any of those pathogens. With your hair covering, make sure your hair is pulled back. If your hair is past your shoulders, you need to have it pulled back so that all of that spray isn't going into your hair. Also, so that your hair doesn't get caught in anything, because that's also very dangerous. Dental dams are so useful when you are trying to reduce anything coming out of the oral cavity. They are not used as often as probably the ADA would like to see that, but they do use them often if you have a sick patient or if you have something that you need from your patient. Then you would just use that dental dam so that you could get the reduction in the spatter coming out With the high volume evacuation or the HVE, it's really important that you're using the HVE and not try to use the saliva ejector. The saliva ejector is just that. You're only going to be removing liquids with the saliva ejector. And yes, it's easier to control, but the HVE is what's going to remove the debris and the liquids from the patient's mouth, and you need to remove both of them. And the HVE also gets a lot of the extra pathogens that are kind of floating around in the air, so it's going to remove a lot more from your patient's mouth. Using patient mouth rinses helps to cut down on bacteria that's in the mouth. So having a patient use a pre-rinse or even a post-rinse will help to remove bacteria in their mouth, but having them use the pre-rinse will help to reduce the amount of bacteria in the air. And then there are air filters that can be used in the office. Now the air filters, that's going to be up to your provider, what is in the office, but air filters can help to remove and reduce bacteria. So dental team to patient, that's very unlikely to happen. So that's like if a team member has a cut or a lesion on their hands while working in the patient's mouth. That can permit the transfer of microorganisms to the patient. To be honest, if you have a severe cut or a lesion on your hand, you should not be working in a patient's mouth. And I'm not saying you shouldn't be at work, but what I am saying is that you shouldn't have your hands in someone's mouth. Now, think about it. If you went to the dentist and someone had lesions or cuts all over their hands, would you want their hands in your mouth? I think not. So have the same sort of respect for your patients. So talk to your provider and let them know what the situation is, and they can put you on some other duty while you are healing and have someone else take your place. That's why it's so important to be cross-trained, and that's why Ross does such a great job of having you learn admin and clinical skills, because when you're cross-trained, then if you do have an issue where you do have these lesions on your hands or a cut on your hands, or if your counterpart in the office say has those issues, you guys can maybe flip-flop for a couple days or a week, and one or the other do chair side and admin while the other one heals, so that the patient isn't at risk and neither are you. So again, if you do have to work on a patient and you are having these issues, it's very important that you are using the proper PPE and that you are immunized. With patient to patient, again, rare in dentistry, there are no reported cases. This would be where one patient got sick from another patient in the office. Ways to control this is instrument sterilization. Make sure that your instruments are being sterilized. So running those spore tests every week, super important. Making sure that you're passing those spore tests every week, super important. Hand washing all the time, using gloves, changing your gloves often, and using sterile instruments on those patients. So every patient gets a new set of sterile instruments, even if they're mother, child, brother, sister, doesn't matter. Everybody gets new instruments. We don't use the same instruments on anybody else unless they've been sterilized, of course. So with the dental office to the community, so microorganisms can leave the dental office by way of the community water or through contaminated impressions sent out to the dental lab. So contaminated equipment sent out for repair, the transportation of microorganisms through the team's hair or clothing. So you have to be careful not to go out of the office. Like if you've got a lot, like you say you've done an procedure with your provider and your clothes get a lot of, like, get wet from the procedure, let's just say that. And if that case happens, after that procedure, you need to go and change your scrubs. You should not be walking around with saturated scrubs on from a procedure. If you have equipment that goes out for repair, you should either sterilize it if it can be sterilized, or disinfect it as much as you possibly can before it goes out for that repair. When you have impressions that are going out to the dental lab, always disinfect them as much as you can. You're not going to be able to sterilize the impressions, but you are going to disinfect them as much as you can to reduce the amount of microorganisms going out into the community. So at the bottom of this slide, they have ways that you can decrease, which are just the exact same things that I just went over, is to make sure that you're hand washing, removing those protective clothings, wear those hair coverings. When they're talking about microorganisms leaving the office, they're talking about your hair again, not just your clothes, because, you know, all of that spray in the air, it's landing in your hair. So dental assistants more and more now are wearing surgical caps or bouffant caps on their hair because they don't want that spatter in their hair. With the community to the dental office to the patient, microorganisms enter the dental office through the municipal water that enters the dental unit. This is what I talked about, just this, I didn't talk about it, but I mentioned the communal water on the last slide. Waterborne organisms, they colonize inside the dental unit water lines and they form biofilm. So as that water flows through the handpiece, the air water syringe and the ultrasonic scaler, the patient can swallow contaminated water. So that's why it's really important that you clean and flush your water lines daily and weekly. So both. So if you are in an office and they're not flushing the water lines, please, please try to implement that system into their daily and weekly cleanings and maintenance systems. So this reduces the number of bacteria that's present. If you flush the handpiece, the air water syringe, and the ultrasonic scaler for at least 60 seconds at the start of the day, and then also use a commercial chemical to reduce the bacteria and flush the lines at least once a week. So what that does is it helps to remove that slime layer. It helps to reduce planktonic, which is the free-floating bacteria, and it helps to keep their equipment nicer as well. So it really does do a lot. So with hand washing, you want to wash your hands each time before you put on gloves and immediately after you remove your gloves. Now, some people will be like, well, why would I do that? I just washed them and I put on clean gloves. You did. You wash them before you put on your gloves to make sure that you have nice, clean hands. You put on your gloves. You wash them when you take off your gloves because you may have gotten something inside of your glove. Your glove may have ripped or torn while you had it on. So you just want to be sure that your hands are clean. You want to wash your hands if you touch a contaminated object or surface while it's barehanded, because you don't know how well it was cleaned, or if even if it was cleaned well, something could have gotten on it since then. So you want to wash your hands in between there. Always use liquid soap during hand washing. Never use a bar soap. Bar soap harbors a lot of bacteria, and it should not be used because it can transmit contamination. For most routine dental procedures, such as examinations and non-surgical procedures, an antimicrobial soap can be used. If you are going to be doing surgical procedures, you should use a germicidal surgical scrub product. And always dry your hands well before donning your gloves. It is very difficult to put on gloves when your hands are wet, for one. And for two, if you do get those gloves on and your hands are wet, inside the gloves is a warm, dark environment. If your hands are wet, that adds moisture to that environment, which is the perfect combination to breed bacteria. So, which is what we do not want. So please make sure your hands are dry before donning your gloves. You also want to keep your nails short and well manicured. Having long nails, you can puncture your gloves and also hurt your patient working in dental because you're going to have your hands inside of their mouth. You want to have your nails looking well, as people are going to be looking at your hands all of the time. Your hands are in their mouth, they're going to be looking at your hands. Don't want to come in there with jagged nails, dirty nails, things like that. You should keep your jewelry to a minimum, not wearing rings except maybe a wedding ring. No fingernail polish or artificial nails should be worn at work, period. No gel, no acrylic, nothing. Dental personnel with open sores or weeping dermatitis must avoid activities involving direct patient contact and handling contaminated instruments or equipment until the condition on the hands is healed. That is extremely important because you don't want to transmit any of that bacteria or any of the pathogens to your patient. There are alcohol-based hand rubs, and they are recommended. They come in the form of gel, foam, and rinses. These are applied to your hands, and then you rub your hands together and cover all the surfaces. They're more effective at reducing microbial flora than plain soap, and that's why I said they're more recommended. The concentrations of 60 to 95% are the most effective. So they do contain things that help reduce chapping, irritation, and drying of your skin. And why is that important? So it's important because if you have dry skin, like dry hands, let's say that you go into a room and you're doing something in an operatory, but you're not the assistant, or even you are the assistant, and you have ungloved hands. If something happens and spatter gets on your hand and your skin is dry, it will immediately absorb whatever lands on your hand. Like say a drop of blood lands on your hand, it will immediately absorb it. However, if your hands are moisturized and a drop of blood lands on your hand, it will not immediately absorb it because that moisture is like a barrier for your skin. Because think about it, your skin is your biggest organ. Your skin is the body's first line of defense. Your skin is there to defend you from those things. So if that blood that's got all maybe pathogens and all these terrible things in it that you don't want inside your body or soaked into your skin, so your skin is like, heck no, I don't want you in me. So it like bounces it off of you and it stops it from absorbing. So then you have time to clean it off. But if your skin is really dry, it's like, ooh, moisture, let me have you. So it soaks it in and then it's gone. So you want to think about that. So the more moisturized your skin is, the better it is for you because your body is better able to defend against things that land on you that are not supposed to be there. So the products are very dose sensitive. So if it says 1 pump of the alcohol-based hand rub, use 1 pump. If it says 2, use 2. You know, if you're using 2 and it only says 1, then you could be overdoing it and then you're going to dry your hands out. With the personal protective equipment, OSHA requires your employer to provide you with the appropriate PPE without any charge to you. So that means your protective clothing. So that doesn't mean they have to provide you with scrubs. Some employers will provide scrubs for you, some will not, but they do have to provide you with a lab jacket at the dental office, surgical masks, face shields, protective eyewear, disposable patient treatment gloves, and heavy-duty utility gloves. So if your eyewear is too tight or loose or fogs up, you should try different models and brands until you find what fits properly. But you do need to know that your employer does have to provide you with these things at no cost. It shouldn't cost you anything to work there safely. With your protective clothing, it's going to protect your skin and your underclothing. So that's why I mean, like, they do have to provide the lab coat, but the underclothing they don't have to provide. But some of them do give you a scrub stipend or scrubs that they provide you with. It protects the underclothing from exposure to saliva, blood, aerosol, and other contaminated materials. So you want to always have that lab jacket on. It's very important. And when you get there in the morning, you put that lab jacket on over your underclothes. And when you go to lunch, you take that lab jacket off. And when you leave for the day, you take that lab jacket off. So when you're out to lunch, you should never have that lab jacket on, or even if you're sitting like in a break room inside your office for lunch, you should take that lab jacket off because it's going to have all that yucky stuff on it that you've collected from your patients throughout the morning. So protective clothing should be like smocks, slacks, skirts, lab coats, surgical scrubs. Surgical scrubs is what you're going to wear in a hospital operating room. And most dental assistants don't wear surgical scrubs, but some of them do. Scrub hats or bouffant hat caps to protect your hair, pants, and shoe covers. So based on the degree of anticipated exposure to infectious materials is going to depend on what type of protective clothing you wear. The bloodborne pathogen prohibits the employee from taking protective clothing home to be laundered. So your lab jacket at minimum should be laundered at the facility that you work. Sometimes your scrubs will be laundered at the facility that you work. You know, when I worked in a dental office, in the morning, I wore my street clothes in and my street shoes in. I came in the morning, I changed into my scrubs there and changed my shoes there. At the end of the day, went back into my street clothes and street shoes and threw my scrubs right into the washer. And then every day in the morning, one of us girls had like the whole calendar was written out for the month. And it was somebody's laundry day every day. And we would just come in, start the washer, and then throughout the day, we would do the laundry from the day before. So some offices have it that way. That was one of my offices. Another office that I was in, they didn't provide our scrubs and our lab coats, but they did provide the lab coats, just not the scrubs. So in the morning, I came in my street shoes, changed into my work shoes, and put my lab coat on. And then we took turns doing the laundry for the lab coats there. So it is different in every office. So when they say the BBP in this slide, know that that is the bloodborne pathogen. And OSHA's bloodborne pathogen protects workers from health hazards caused by bloodborne pathogens. And universal precautions are infection control measures designed to prevent the transmission of those bloodborne pathogens. That's everything that we're going to go over in this chapter. Thank you.